Module Overview. In modern healthcare, transmission-based precautions and isolation protocols are essential in preventing the spread of high-risk or epidemic-prone infections, particularly in vulnerable patient populations and healthcare workers. Unlike standard precautions, which apply to all patients, transmission-based precautions are additional strategies applied when patients are suspected or confirmed to be infected with specific pathogens that require heightened control measures. This module provides a comprehensive and systems-level analysis of the types of transmission-based precautions, their indications, infrastructure requirements, challenges during pandemics, ethical considerations, and global best practices. The module is tailored for post-COVID realities, integrating lessons learned from managing airborne viruses such as SARS-CoV-2, MERS-CoV, and influenza. This content aligns with guidelines from WHO, CDC, ECDC, NHS, and Accreditation Canada, ensuring global standard compliance. 1. Introduction to transmission-based precautions. What are transmission-based precautions? Transmission-based precautions are infection control measures used in addition to standard precautions when patients are known or suspected to be infected with pathogens that can spread via specific routes, contact, droplet, or airborne. They are designed to prevent healthcare-associated infections, HAIs, protect healthcare workers and visitors, prevent cross-contamination of equipment and the environment. 2. Modes of transmission in clinical settings. Contact transmission, direct, physical transfer of pathogens, e.g., MRSA, scabies. Indirect, contaminated instrument surfaces, e.g., C. difficile. Droplet transmission spread via large respiratory droplets, e.g., influenza, RSV, pertussis. Travel approximately 1 meter, 3 feet, before settling airborne transmission spread via smaller particles less than 5 microns suspended in air, for example, tuberculosis, measles, COVID-19, can remain airborne for long periods and travel longer distances. 3. Categories of transmission-based precautions. A. Contact precautions used for MR, SA, VRE, C. difficile, open wounds, key measures, gloves and gown upon room entry, dedicated equipment or proper disinfection, private room or cohorting patients. B. Droplet precautions used for influenza, pertussis, COVID-19, early variants, key measures, surgical mask within 1 meter of patient eye protection. If splash is anticipated, patient wears a mask when being transported. C. Airborne precautions used for tuberculosis, measles, chickenpox, COVID-19, aerosol generating procedures. Key measures, N95/F, FP2/FFP, 3 respirators, negative pressure isolation rooms, AIIRS, keep room door closed at all times, limited patient movement. 4. Isolation protocols. A. Types of isolation, strict isolation, complete PPE, limited contact, e.g., Ebola. Protective isolation, to protect immunocompromised patients, e.g., neutropenia. Cohorting, grouping infected patients with the same condition. Reverse isolation, applied in oncology or transplant units. B. Room design and environmental controls, negative pressure rooms with HEPA, filtration, anterooms for donning, doffing, PPE air exchange rates, greater than or equal to 12 ACH air changes per hour, use of UVC lights and antimicrobial surfaces. 5. Post-COVID innovations in transmission control. Redefinition of airborne versus droplet transmission. COVID-19 showed that droplets can remain suspended longer than expected. WHO and CDC updated guidance to treat some droplet pathogens with airborne precautions during AGPs. Universal masking in healthcare settings during outbreaks, PPE zoning and movement protocols in isolation wards, digital contact tracing systems, training simulations and fit testing drills, real-time air quality monitoring. 6. Ethical, legal, and operational considerations. Ethical dilemmas, balancing patient privacy with the need to isolate consent and disclosure, informing patients and families, staff fatigue and mental health, long hours in isolation units, legal duty to protect workers under occupational safety laws, accreditation standards, mandating documented isolation training and drills. 7. Global best practices and guidelines. WHO, Core IPC components and COVID-19 IPC strategy. CDC, guidelines for isolation precautions. ECDC, guidance on managing multi-drug resistant organisms. NHS England, National Infection Control Manuals. Accreditation Canada, Infection Prevention Compliance Framework.